Hi, I'm Dr. Laura Grashow, a licensed psychologist with drgrashow.com. Please remember that advice from this video is not intended to replace actual psychotherapy. Okay, so now let's talk about how to test a child for ADHD. From my point of view and in my experience, this is, it can be a lengthy process and it's a complicated process. It's not just a matter of, reporting some symptoms and filling out a questionnaire. Again, from my point of view, this testing is best done by a child psychologist. We are usually the best qualified to do this. You have to take into account a number of factors, such as biological factors, cognitive factors, and then social and environmental factors. When I see a child in my office presenting with the symptoms of ADHD, such as impulsivity, high activity levels, and inattention, I need to spend some time with the child. I also need to spend some time interviewing the parents and getting to really know the family a little bit. What I want to find out is, did these symptoms appear before age 7? Have they been present for at least 6 months? And are they present across settings? And the other thing that you really want to take note of is, are the symptoms much greater, or these behaviors much greater than you would see in a typical population? And if you're talking about, for example, a young child, maybe a preschooler or a kindergartner who's a boy, you think about this population, they're very active. So when you're diagnosing a child in this category, a boy, who's relatively young with ADHD, if you're looking at inattention, impulsivity, and hyperactivity, they've got to be beyond what you see in young boys. Testing a child is, again, it's a lengthy process. It involves doing tests of cognitive functioning, looking at some tests of neuropsychological functioning, especially those having to do with memory, interviewing the family, talking to teachers and parents, and then you've got to really put it all together in a comprehensive report, and you should be able to make a proper diagnosis that way.